Good afternoon. Respected Chairperson, dignitaries on the dais, ladies and gentlemen. It's my privilege to be here with you in the bridging gap in diabetes and retina. On the eve of my speech, I pay my deepest homage to our father of the nation, Bangabandhu Sheikh Mujibur Rahman, and Bangamata Sheikh Fadiluddin Hasan Mujib, and all the martyrs of 1975, and all the freedom fighters who sacrificed their life for our country in 1971. Today, I am very happy that this government has given us many good scopes along with prevention of diseases. Our life expectancy is now 76 in some of the newspaper it was told. And as the life expectancy is increasing, this type of disease are being increased, like diabetes, diabetic retinopathy, nephropathy, systemic hypertension, all these are due to diabetes. But diabetes is also a good disease. It makes a person disciplined. As because I have seen the people who has diabetes, he is always disciplined and he is dependent on drugs, maybe injection, and also they are to take the limited diets. I think diabetes, as it is a disciplinary disease, we should make ourselves also disciplined in such a way that our government has given the community vision center in the community areas. So how we can collaborate with the tertiary levels? Already they have made that there is the artificial intelligence in diabetic screening. There may be the fundus photograph that will be sent to the secondary or tertiary level, and from there what person is needed of laser treatment or injection or any other thing, they will invite them to the tertiary level. So in this way we can start. But when to screen? I think each and everyone, one of the speakers was telling, and I thank all the speakers, that is Dr. Shahjad Salim and Professor Nujat Chaudhary, they have discussed in detail, and someone told that everyone, when they will go to some of the chambers, they should know that if you are diabetic, where to go? You should have a fundus photograph, you should go or consult the ophthalmologist and also nephrologist and also cardiologist, and not the surgeon, as because sometimes there is the gangrene if it is late. So due to diabetes, there may be diabetic gangrene. So the person, if he knows in any chamber, all the doctors can put this type of slogan there and keep a banner or festoon that if you are diabetic, you are to consult this type of specialist. Number one. And number two, we should also aware that each and every ophthalmologist, they should examine the fundus. If any doctor comes, not only refraction, you are to examine the fundus, and without examining the fundus, no patient should go from you. It should be an ethical practice, and if we can do it, many of the patients can be diagnosed. I have seen that in uveitis, when we diagnose uveitis in our chamber, we send it to other persons that there is rheumatism or rheumatoid arthritis, he may be urethritis, and in this way they can be diagnosed. In this way, in our chamber, many people doesn't know that he has diabetes. As because many patients before operation, we when we give the blood count or blood sugar estimation, at that time the patient may have 20 blood sugar. In this way, if we can diagnose the fundus, we can diagnose the patient as a diabetic, and then he will be able to treat with the drugs. And after 1 year or 5 years, type 2 diabetes every 1 year, and if it is type 1, every 5 years. There too, examine, but I think it should not be. Any patient diabetic, he should at least once in a year they should consult the ophthalmologist. What is the situation? What is the progress of diabetic retinopathy? Because diabetic retinopathy is a deadly disease and blinding disease, and everyone, I am not giving any, everyone should not be afraid of, as because every diabetic patient is not blind. As they control their blood sugar, if they consult with the ophthalmologist, I think we have many options by giving injection, anti-VEGF or any operation, a patient can be cured. So we should not be afraid of, but each and every diabetic patient, they should consult the ophthalmologist. That should be our message today, and also the nephrologist, neurologist, maybe for blood pressure, they can consult the cardiologist. In this way, we can make many people preventing them to be blind. I think this type of initiation, which have been initiated by two societies, Bangladesh Vitreoretina Society and the Endocrine Society, in future the Renal Association can be with us, Cardiac Association maybe with us, and also neurologists. They can also combine with us, so that a diabetic patient will not suffer from their many complications. With these few words, thank you very much for patient sharing. I hope you will be, you have the new persons who has come first here. I think this auditorium is chosen by you, and in future all the society, I hope they will come for their any meetings or any seminars or workshops, which will be very much effective. If you think that you have only 300 people, we have 300 people's room. If you think we have 500, we have another 500 rooms. And if you can have your diet, you can have in our first floor, there is this type of presentation can be done along with your lunch. I think we have made this thing for all the doctors of Bangladesh, and in future you will also cooperate us, and I will welcome you. With these few words, thank you very much for patient sharing. Joy Bangla, Joy Bangabandhu, long live Bangladesh.
Thank you, Maranyu Parjoji sir.